We're going to be doing a rotatory support tape job for the knee. For materials, you'll need elastic non-tear tape, probably a lot of it, heel and lace pads. Also, you're going to want to prepare a Gumby strip of tape with sort of 2 legs and 2 arms coming off of it. You'll see in a minute why this is necessary. So first off, we're going to check PMS. So, do you feel that?
Yep.
Can you wiggle your toes? Alrighty, and checking cap refill. Okay, we have a baseline, so now we're ready to get taping. So for this,
I can see, right?
I think so. It should be able to. Yeah, it's at your knee. Yeah.
Okay.
So for this, the first thing we're going to do is we're going to put a heel and lace pad inside of the popliteal fossa, which is the area. It's fine.
Because I moved it.
It's fine.
Okay.
Area at the back of the knee here. So we're just going to put a heel and lace pad. This will prevent any rubbing sort of from developing, as we're literally going to be laying this Gumby strip right over it. So first things first, you mind just turning around actually?
Yeah.
Thank you. We're gonna make sure he loads the joint so it has muscle tone. You kind of want to be doing this. It's a little tiring for the athlete because you're gonna be here a little while, but you need to apply this tape job onto a loaded limb. So, what we're going to begin by doing is we're going to place the body, so to speak, of our Gumby in the fossa. So I'm just doing this so it's easier just to work off of. And then the arms are going to hug the upper limb. I'm sorry.
It's okay.
They're going to hug the upper limb.
Roll up more or anything.
And then the bottom, the legs per se, are going to hug the lower limb. They're going to hug around his calf, like so. This will help prevent hyperextension, which is a common mechanism for injury to the knee ligaments.
I'm untaping a little bit at the top.
Pardon?
The top's coming off a little bit.
A little bit? Okay.
Am I allowed to fix them if they're coming off?
Yeah, yeah. Okay. The next thing we're going to do is we're going to apply rotational support tape of just the full strips over the leg. So you mind just turning around?
Sure.
Thank you. So first things first, we're going to have strips kind of making a diamond around the patella because we want to leave that exposed because it's a pulley involved with the firing of the quads. So if we inhibit it, we could cause it to track different, cause problems. Also, you want your quads to be able to move. So what we're going to do is we are going to start from the bottom per se. So we're going to make a diamond basically. This is going to wrap around the back of his leg, ending on the femur. So ending about on mid-femur, whatever you want. It just has to round. And we're going to cut that. Make sure your scissors are nice and sharp. If they're gummed up, it will have a hard time cutting this. And then what we're going to be doing is the other side now. So the other side...
Should I rotate over so they can see that?
No, it's okay. So what we're going to be doing is we're going to start on the other side of the tibia. And we're going to round around the other side.
Should I have worn Under Armour over this?
I don't believe so.
Okay.
But basically what I'm doing is I'm creating a brace out of tape for your leg.
Mm-hmm.
So it might actually, it probably wouldn't work as effectively at very least.
Mm-hmm.
I don't know, honestly, if it would work, to be honest with you.
But for the purpose of
For the purpose of the tape job, we're doing it on a bare leg because this is kind of what you'd want. Next, we're going to apply the femur strips, which are going to go around the patella superiorly instead of inferior like the tibia strips just now. So for these, what we're going to do, we're just going to round his patella like this. Yep, I'm sorry. This tape is very sticky, so just be aware. Beware. If you can, honestly, like the only sport this would really be used in is rugby because rugby's not allowed to have, they're not allowed to have braces on. So we're going to do this. Just give me a second while I cut this. It's kind of a pain.
Am I loaded enough still?
Yep. As long as you keep tone in it, you're fine.
Okay.
And then what we're going to do is we're going to do around the other way. You'll notice the diamond we've created now around the patella as we've loaded the joint. And we're just gonna snip this. So typically you do more rounds of this, but for the sake of time and materials, I'm not going to do that. But that is generally the gist of the tape job. You do more strips as needed. You could do 2 or 3 or however many as the athlete wants to feel supported. Typically you'd do at least 2 rounds of it. And yeah, so this is the tape job. You want to look around, make sure like nowhere is sort of open.
It's rolling away again, by the way.
Pardon?
It's out of the chair.
Wonderful. I hate the tape. So I see a tag here. I'm just going to snip that just to make sure it doesn't bother the athlete.
I'm out of mic next.
So you just snip, snip, snip. So now the tape lays nicely. That is the tape job. Now we're going to have the athlete do some sport-specific functional movements. How does it feel?
Good. Supported.
Yeah, you can feel the support.
Mm-hmm. Yep.
Yeah. And
oh fuck.
so you play.
Basketball.
Okay, so just give me some jumps and some jumps and some movements, some side to side maybe. Some of the tougher movements on the knee for basketball.
Whoa. Carpet.
Okay. So that's the tape job. Again, for the sake of time, I just did 1 layer of the strips for the rotational portion. However, you need to do more than just 1 layer. Typically, you do at least 2 or 3. And yeah, but that is the tape job.